The picture here in the background there, that's the Detroit River. And I mentioned we're coming to you from Kitchener, Ontario, and this relationship between Kitchener, well, between Waterloo region and the Detroit River, and that is firmly rooted in alcohol prohibition, where alcohol was manufactured here and loaded on trains or and sent to the Detroit River, where they met typically organized crime, like think Al Capone and that kind of thing, rode across the river and sold and distributed in the States. So that really helped with feeding the demand for alcohol during the American Prohibition. And that was, of course, supplemented by more underground manufacturing processes that resulted in bathtub gin and a really toxic supply. And the parallels to today are not lost on many of us. In the bottom right here, you'll see this is where Jesse, Sarah, and I are coming to you from today. This is the original governor's house, where people who were Indigenous, Black, or persons of color, people on lower incomes were disproportionately incarcerated, not because they lacked any moral sense or that kind of thing. It's just a feature of the criminal justice system then and now. And these are photos. This one bottom left is downtown Waterloo, across from the Hoother Hotel. Lots of money to be made during Prohibition for the Bronfman family, the Seagram's Empire, and others. And during that time, we're talking about the 20s and primarily, but at the turn of the century, there was a real movement to prohibit alcohol and other drugs here in Canada. This was some of the flavor of the times. It was firmly rooted in racism, as Judah and Ruth have mentioned, and it was firmly rooted in notions, antiquated notions of what is moral and what is immoral. And it's always been about keeping our white good girls safe. And I'm reminded, almost 100 years later, when Crime Prevention Council had flagged the emergence of the bootleg fentanyls as a threat to health and safety, and how difficult it was to get traction. And I remember one of those times where things sort of shifted forward, at least temporarily, was when a white suburban teenage girl passed away from an overdose. It got traction in media across the country and really ramped up the discussion. And but before that, so many people have passed away, and I'm not going to go through the numbers, the fatalities. They're grim as they ever were. Ontario has been on a record-setting pace ever since 2000, and 2022 shows no sign of better. So we had some experience with alcohol prohibition here locally. We also had the establishment of the Canadian, the Opium Act of 1908. And it really overnight went from a substance you could use recreationally or to manage withdrawal, and it became a criminal act. And overnight, certain people were criminalized, and that was primarily folks of Asian descent. Our Indigenous brothers and sisters have always faced disproportionate discrimination preceding the Opium Act of 1908, through such measures as the Indian Act, long overdue for an overhaul. This was Emily Murphy was a key crusader at the time. She fed lots of stuff into the federal government. She was the first female police magistrate outside of England. And this is the kind of stuff that she was responsible for, but she also had a go at other health issues. She managed to criminalize syphilis, and disproportionately women ended up in jail because they had syphilis. So if there was any doubt that prohibition is rooted in racism and antiquated notions of immorality, I think this backs it up. And we had a local MP, this is almost 100 years ago, after the experience of alcohol prohibition, advocating for ending alcohol prohibition for a whole bunch of reasons. But first of all, and foremost, it produced no good results. More recently, earlier in January, the Chief Coroner of British Columbia, Dr. Lisa Lapointe, made the argument that many of my colleagues have been making for many years, and that is it's a drug policy crisis. And the continued use of enforcement and justice systems, despite best efforts, despite billions of dollars being flowing into those systems every year, that arguably it does more harm than good. And the criminal justice system really is the major intervention that we continue to use in Canada. And from research locally that we did, this is the Unsafe study. When we talked to people who were using unregulated drugs and lacked stable housing, 95% of them had been incarcerated as an adult. The average number of times they'd been in and out of jail was 12. And the comments people were making was that it does, in fact, do more harm than good. There's a bunch of stuff in that research, but we looked at victimization too. Most people had been a victim of a crime multiple times, sometimes every day. Most people would never report those crimes to police for fear of getting entangled in the criminal justice system. The committee was established following a motion from the Crime Prevention Council in the fall of 2021. And we began by looking for evidence of effectiveness for this thing called prohibition. And if it was ever intended or if we ever hoped that it was have a positive effect on the demand for unregulated substances or the supply of unregulated substances, we came up empty. And I don't think anyone here will be surprised that there's a different standard applied to evaluating certain laws and policy that is not in place for many of our nonprofit partners, for example. But we could find no evidence of effectiveness in that regard when it comes to prohibition. And we wouldn't be the first group to be looking at those kinds of looking for that kind of evidence. The Ledane Commission of Canada, about 50 years ago, had the same experience. Others before and others since, including the Health Canada Expert Advisory Committee that released their report in the summer of last year. And so that's why many people say it's a drug policy crisis. And I want to show you really quickly perhaps evidence of that. If you take an opioid or an opiate, whether it's heroin or fentanyl or hydromorphone, it has certain pharmaceutical properties. And those include euphoria. If you're using on a regular basis long enough and you stop, you will experience withdrawal, you will experience constipation, etc. Those are pharmaceutical properties of the substance. What is not a pharmaceutical property and what is more of a phenomenological human construct are things like overdose poisoning. If you know the dose and you know the quality, you're unlikely to overdose. You are not going to pick up HIV/AIDS or hepatitis C. Those are more functions of the criminalization because people have to hide their use and use in unsafe conditions, despite the best efforts of organizations like ACWA and so on. Crime and victimization, the violence that breaks out over primarily around battling for a drug market share following police crackdowns. Those are not pharmaceutical properties. They are properties of prohibition. And we asked people in that same unsafe survey, what would happen if we provided safe supply? And safe supply is sort of a medical model. It's different than prohibition, decriminalization, or legalization, but it attempts to provide pharmaceutical equivalents to some of those unregulated drugs, primarily opiates. And we have a small program here in Waterloo Region, and we're grateful for it, but we always knew that there was no way a small program could meet the demand, and that's true today. There's a wait list for sure, but we asked people what would happen if instead of finding a dealer and procuring what you think is fentanyl, for example, what would happen if you went to a pharmacy and picked that up? And these are some of the things people said: less homelessness, less crime, less victimization, less overdoses, and importantly, to Sarah's point, people really talked about, that would enable eliminating some of the chaos out of their lives, bring stability, and help them reestablish relationships with family and friends and others. So we have this broader drug policy opportunity before us. It's always been arbitrary. It's always been a choice, and it's more squarely rooted in the federal government. This is adapted from John Marks, and you can see on the left health and social problems. You don't want to be near the top, you want to be near the bottom. And on the bottom, different kind of regulatory models. And the sweet spot is really around legalization with strict regulation. We have recent experience with cannabis. For years, it was vilified, and the people that use cannabis were vilified, and disproportionately Indigenous, Black, and people of color were vilified and criminalized. And we have a few years of experience of legalizing cannabis, and the world hasn't ended. And I think most people would agree that we're on a better path than the way we were. This is from the Canadian Centre on Substance Use, a range of different interventions, some with a heavy criminal involvement, some with none. And these are in the report, and you can check it out at your leisure. What the committee did consider, and we didn't consider safe supply because that's not a national policy type environment. We consider prohibition, which you know of. It's enshrined within the Controlled Drugs and Substances Act. We considered decriminalization, and there's a couple of versions out there. In one version, police and the justice system very much remain gateholders to whether to administer sanctions or not. So there's all kinds of implications there. There are thresholds involved. How much fentanyl can you hold? A gram, 10 grams. These are really sticky questions that maybe limit the drive towards equity. But another version, and I would encourage you to check out the HIV Legal Network. They've done some amazing work that way. That version would see no police involvement and no thresholds. And then finally, we considered legalization with strict regulation, where those drugs that are currently illegal are made legal, and they are subject to all the quality control standards, the consumer safety protections that other food, drugs, and consumer items enjoy. And regulation here doesn't mean more enforcement. It means similar kind of mechanisms that we might see with the Canadian Food Inspection Agency, for example. And certainly it would include the application of core public health principles that guide issues of contamination when your lettuce is infected with listeria, or your chicken's contaminated with salmonella, where those drugs are pulled and replaced by a safer supply. So without further ado, I'd like to turn it over to my colleague Jesse, and he'll walk you through some of the criteria that the committee thought was important, and where we ended up with in terms of prohibition, decriminalization, and regulation.